The average cost of health insurance in 2023. What does health insurance cost per state? Are you curious about the price of private health insurance? The truth is that depending on where you live, monthly premiums can vary greatly. Maryland has the lowest health insurance premiums, with an average monthly payment of $338 for a 40-year-old. West Virginia, on the other hand, has the highest monthly average premium at $712. Rate variations are caused by things like how competitive a state is, which forces insurers to provide competitive prices. The estimated health costs of a population may also affect expenditures. For instance, insurance companies set higher premiums to cover those costs in places where individuals tend to be less healthy or where doctors and hospitals charge more. What does health insurance cost based on family size? It should come as no surprise that the more the number of family members covered by your health insurance plan, the higher the rates you may expect to spend. The average monthly cost for a couple in their 40s is $954, which is double what it would be for an individual in that age bracket. But adding children isn't quite as straightforward. A family of 5 would pay around $1,782 per month, and a 40-year-old couple with one child under 14 would pay about $1,230. MoneyGeek used age-specific national averages to calculate the average family's health insurance cost. The premiums were then added. The cost of family coverage may vary. Emily type average monthly cost individual, 40-year-old, $477 couple, 2 40-year-olds, $954 couple with a kid, age 0 to 14, $1,230 couple W/2 kids, ages 0 to 14, $1,506 couple W/3 kids, ages 0 to 14, $1,782. Families should pool their resources to purchase health insurance since it is straightforward and simple to do so. You're also more likely to reach the out-of-pocket maximum as a group, at which point you shouldn't be responsible for any additional out-of-pocket expenses for covered treatments. However, some families might benefit more from having different plans. For instance, it might make sense for one spouse to use employer-provided insurance while the rest of the family enrolls in a marketplace plan if the other spouse can obtain affordable coverage via their employment but the plan may not cover family members, or it may be too expensive to add them, or one partner may benefit from paying more for additional coverage if they have more medical demands and higher costs. However, if the other partner doesn't need much medical attention, they might do better with a high-deductible plan for themselves. The cost of health insurance on average by age. Age-related increases in healthcare needs are generally accompanied by increases in health insurance premiums to cover these anticipated expenditures. The average premium for an 18-year-old, according to MoneyGeek's estimate, was $324 per month, while it was $642 for a 50-year-old and $970 for a 60-year-old. This analysis does not take into account tax credits or other subsidies. However, if they have low incomes, such as if they have retired or reduced their hours of employment, older persons may be qualified for larger subsidies. Average health insurance premiums by age. Average monthly cost $1,824, $2,372, $4,477, $5,642, $6,970. The cost of health insurance on average, broken down by plan type and metal tier. The kind of health plan and degree of protection you select have an impact on the cost of your insurance. For instance, you might be ready to pay extra if it makes it simpler for you to access a wider variety of providers, such as through a point of service, POS, or preferred provider organization, PPO, plan. Or you might choose a health maintenance organization, HMO, or exclusive provider organization, EPO, plan that offers less freedom but lower than average prices. How much of the expense of care is covered by your insurance is something else to take into account in relation to the premiums you'll pay. Different metallic tiers, bronze, silver, gold, and platinum, determine how much of your medical costs your plan will cover. The more a plan covers, as you might anticipate, the higher your premiums will normally cost. The cost of health insurance on average by plan types. There are 4 different categories of health plans available on the marketplace, each with a different level of flexibility and price. Health maintenance organization, HMO except in emergencies. HMOs usually offer lower premiums but compel you to use a particular network of doctors and receive specialist referrals. Silver HMOs cost $473 on average a month. Exclusive Provider Organization, EPO, situated in the middle of an HMO and a PPO. An EPO often mandates that you use its in-network doctors and hospitals, while you are not always required to have a referral in order to see a specialist. A typical EPO Silver plan is $508 per month. Preferred Provider Organization, PPOs often cost more than HMOs but allow access to a wider variety of healthcare professionals. For covered services, you typically don't need a referral in order to see a specialist. The average premium for Silver PPO plans on the marketplace is $517. Point of service, POS plans often offer the greatest degree of flexibility, but at a higher cost. Outside of the health plan's provider network, you can typically get care, but you'll probably have to pay more. The average monthly cost of POS Silver plans is $534.